Botulism. Botulism is an uncommon yet genuine condition brought about by poisons from microscopic organisms called Clostridium botulinum. Three regular types of botulism are: foodborne botulism. The destructive microorganisms flourish and produce the poison in conditions with little oxygen, for example, in home canned food. Wound botulism. On the off chance that these microorganisms get into a cut, they can cause a hazardous disease that delivers the poison. Newborn child botulism. This most normal type of botulism starts after Clostridium botulinum bacterial spores fill in a child's intestinal plot. It commonly happens in children between the ages of 2 months and 8 months. A wide range of botulism can be lethal and are viewed as health-related crises. Side effects. Foodborne botulism. Signs and side effects of foodborne botulism regularly start somewhere in the range of 12 and 36 hours after the poison gets into your body. However, contingent upon how much poison was burned through, the beginning of indications may go from a couple of hours to a couple of days. Signs and manifestations of foodborne botulism include: trouble gulping or talking, dry mouth, facial shortcoming on the two sides of the face, obscured or twofold vision, hanging eyelids, inconvenience relaxing, sickness, spewing and stomach cramps, loss of motion. Wound botulism. Signs and side effects of wound botulism show up around 10 days after the poison has entered the body. Wound botulism signs and manifestations include: trouble gulping or talking, facial shortcoming on the two sides of the face, obscured or twofold vision, hanging eyelids, inconvenience relaxing, loss of motion. The injury might seem red and swollen. Baby botulism. In the event that newborn child botulism is identified with food, like nectar, issues by and large start inside 18 to a day and a half after the poison enters the child's body. Signs and indications include: blockage, which is frequently the main sign, floppy developments because of muscle shortcoming and inconvenience controlling the head, powerless cry, fractiousness, slobbering, hanging eyelids, sleepiness, trouble sucking or taking care of, loss of motion. Certain signs and indications typically don't happen with botulism. For instance, botulism doesn't for the most part increment circulatory strain or pulse, or create fever or turmoil. At times, nonetheless, twisted botulism may cause fever. When to see a specialist. Look for dire clinical consideration on the off chance that you speculate that you have botulism. Early treatment expands your odds of endurance and reduces your danger of complexities. Looking for clinical consideration quickly may likewise caution general well-being specialists. They may then have the option to hold others back from eating sullied food. Botulism isn't infectious from one individual to another. Causes. Foodborne botulism. The wellspring of foodborne botulism is frequently home canned food sources that are low in corrosive, like natural products, vegetables and fish. Notwithstanding, the infection has likewise happened from hot peppers, chilies, foil-wrapped prepared potatoes and oil mixed with garlic. At the point when you eat food containing the poison, it disturbs nerve work, causing loss of motion. Wound botulism. At the point when C. botulinum microscopic organisms get into an injury, perhaps brought about by a physical issue you probably won't see, they can increase and deliver poison. Wound botulism has expanded in late a long time in individuals who infuse heroin, which can contain spores of the microorganisms. Indeed, this sort of botulism is more normal in individuals who infuse dark tar heroin. Baby botulism. Children get baby botulism in the wake of burning through spores of the microorganisms, which at that point develop and duplicate in their intestinal plots and make poisons. The wellspring of baby botulism might be nectar, however it's bound to be openness to soil tainted with the microscopic organisms. Are there advantages to botulinum poison? You may think about how something so harmful might be advantageous. However, researchers have tracked down that the deadening impact of botulinum poison makes it valuable in specific conditions. Botulinum poison has been utilized to lessen facial wrinkles by forestalling withdrawal of muscles underneath the skin and for ailments, like eyelid fits and extreme migraines. Nonetheless, there have been uncommon events of genuine results, for example, muscle loss of motion stretching out past the treated territory, with the utilization of botulinum poison for clinical reasons. Make certain to utilize an authorized specialist for any restorative or operations utilizing botulinum toxin A, Botox. Complexities. Since it influences muscle control all through your body, botulinum poison can cause numerous difficulties. The most impending risk is that you will not have the option to inhale, which is the most widely recognized reason for death in botulism. Different inconveniences, which may require recovery, may include trouble talking, inconvenience gulping, dependable shortcoming, windedness, counteraction. Utilize appropriate canning methods. Make certain to utilize appropriate procedures while canning food sources at home to guarantee that any botulism germs in the food are obliterated. Pressing factor: cook these food sources at 250 F, 121 C, for 20 to 100 minutes, contingent upon the food. Think about heating up these food sources for 10 minutes prior to serving them. Get ready and store food securely. Try not to eat safeguarded food if its compartment is protruding or if the food smells ruined. Notwithstanding, taste and smell will not generally part with the presence of C. botulinum. A few strains don't make food smell horrible or taste surprising. In the event that you envelop potatoes by foil prior to heating them, eat them hot or extricate the foil and store them in the fridge, not at room temperature. Store oils implanted with garlic or spices in the fridge. Baby botulism. To decrease the danger of baby botulism, try not to give nectar, even a small taste, to youngsters younger than 1 year. Wound botulism. To forestall wound botulism and other genuine bloodborne sicknesses, never infuse or breathe in road drugs.